Hi, everybody, and welcome to our session today. My name is Lana Castellucci, and I'm a thrombosis physician in Ottawa, Canada. And it's a great pleasure to be here today and to collaborate with the Canadian Cancer Survivor Network. And we are going to talk about cancer-associated thrombosis, what patients and caregivers need to know. Next slide, please. And it gives me great pleasure to introduce our speaker today. So we have Dr. Sufei Wang, who is a hematologist and associate professor in the Division of Hematology, Department of Medicine at the University of Ottawa. And Dr. Wang is also an associate scientist at the Ottawa Hospital Research Institute. Her main areas of clinical and research focus are on patients with cancer-associated thrombosis. And she's also very productive in drug-drug interactions between anticoagulants and other medications, as well as looking at patients who have obesity-related thromboembolism. Her research program has received funding from the Canadian Institutes of Health Research and the Ottawa Hospital Academic Medical Organization. She is co-chair of the ISTH SSC on hemostasis and malignancy, and it's wonderful to have her here today. And I will turn it over to Dr. Sufei Wang in a moment. I would like to ask our participants today that if you have any questions, please enter them into the chat, and we will address your questions at the end of the presentation. So please feel free to use the chat function rather than the Q&A. Thanks so much. Dr. Wang?
Okay. Thank you, Dr. Castellucci. Thank you, everybody, for joining the session. And I have the pleasure and honor to come here and present to you and kind of talk about thrombosis in this very special day, the World Thrombosis Day, which we'll talk about in a bit. So our goal is to really raise awareness and really kind of discuss what patient and and caretakers should be aware of and should know about thrombosis, particularly from the angle of cancer-associated thrombosis. But we'll talk about thrombosis in general as well. And yeah, please feel free to type in the question, and we'll answer all of them at the end. So. To start with, thrombosis, what's really thrombosis? So thrombosis is the formation of a blood clot, or sometimes we call it a thrombus, really in the vein, or in the arteries or in the blood vessel. So once it's in there, it will block the flow and prevents the blood flow from circulation, and that can cause associated symptoms. So why is thrombosis important? Thrombosis is actually the top three, the number three cardiovascular killer right after heart attack and stroke. And 1 in 4 patients can die from conditions caused by thrombosis in general. So then there are many actually famous people, many of them you probably know, that also have thrombosis or suffer from venous thrombosis, including Hillary Clinton, Serena Williams, and Chris Bush, and James Ward. So what do you need to know about thrombosis, or what's really thrombosis, to kind of dive in more deeply? We mainly our general term when you hear about your doctor or healthcare providers talking about is something called VTE. So VTE stands for venous thrombosis, and VTE basically is a combination of DVT and PE. So deep vein thrombosis, DVT, or PE is a pulmonary embolism, and we'll talk about each one of them separately in detail. So first is the DVT, or deep vein thrombosis. So again, it's a blood clot. So it's a thrombosis of blood clot, mainly happening in the veins in the leg. It also can be happening in the arm as well, but leg will be more common. When it happens in the arm, usually it's kind of associated with central venous catheters, such as a PICC line or catheter like a porta-cap. So the main symptoms of deep vein thrombosis is quite a few, as listed here. I highlighted the 4 that's really the most common symptoms. That includes pain, swelling, warmth, and redness. And it's, as you can see, depending on where the blood clot is, usually where the symptoms are. Say if the blood clot is in the leg, usually can cause anywhere between leg angle, even up to the thigh swelling or pain, warmness or redness. And if a blood clot is in the arm, and again associated symptoms in the location. Usually, blood clot happens in one extremity, so one arm or one leg, but occasionally, especially in cancer patients, which we'll discuss, do have a higher risk of having blood clot. That very rarely can present with both sides. So again, you don't have to have all these symptoms to have blood clot. You can have, either one or any combination of these, or occasionally, actually, some patients don't even have symptoms. Something we call asymptomatic blood clot that's picked up by, say, imaging study for other reasons. So that's also possible. But again, most of the time, if a blood clot is severe and big enough, you would have one of these symptoms. So these are definitely the symptoms to look out for if in the patient. So again, a blood clot in the leg is a blood clot from the blockage in the vein, usually in the leg or less commonly in the arm. And the reason people will start having symptoms because when there's blockage of blood flow, that's when the congestion of the blood flow happens, causes redness and swelling and pain. So the incidence of blood clot in the general population, so we'll talk about just like in general, is actually about 1 in 1,000. It's certainly increased with age. So in the really young kids or up to 18, the risk is very low, but as one ages, the frequency does increase. And when you get over like age of 80 and above, it can actually get as high as 1 in 100 people may got diagnosed with blood clot in the at some time. So we'll discuss a little bit later about what's the risk factors, what other factors that predispose people for having blood clot. But I would say that a lot of them, one of the factors is hospitalization. So you can see that 60% of all clotting events happen in the hospital up to 90 days after. And particularly our topic today in cancer is also very, very common. It's about 1 in 5 cancer patients could have blood clot throughout their journey. So that's blood clot in the leg or arm, we call DVT. So then what about PE? So PE stands for pulmonary embolism. So so pulmonary means lung. So PE basically means that it's a blood clot that happens in the lung. Typically, about 2/3 of the time, you will actually start with a blood clot mainly in the leg that travels to the lung, but it doesn't have to be. People can certainly have blood clot starts in the lung. There are also 4 most common signs and symptoms of blood clot in the lung, and including others, as you can see here. I also highlight the most common one 4 in red. So most common is chest pain and short of breath. Then people can have what we call hypoxia or low oxygen saturation or fast heart rate. That's the tachycardia means, or people could cough up blood. So, and we often discuss with patients that the chest pain and shortness of breath usually is quite unusual. It's not something like, say, if you climb a stair, you got a little short, and then you rest a little bit to get better right away. So we're not talking about that. We're talking about I have a patient who say that they have very severe chest pain all of a sudden, and that's very unusual. They've never happened to them before, or they are so short of breath that they can barely walk 1 flight of stairs or 1 block. So those are certainly unusual for them, and these are definitely the symptoms to watch out for. So again, I want to emphasize that if you have one of these above symptoms, there could be a blood clot. Now, certainly these symptoms could be from other things as well. We're not saying that these symptoms always mean blood clot, but we certainly want people to be aware that these are the things to pay attention, and don't sit at home and thinking you will get better, especially if they are severe, and we'll definitely recommend to seek urgent medical attention. A lot of times for cancer patients also, they also can be quite challenging, as cancer patient getting a lot of cancer therapy, and their blood counts are not too good to start with. They could have some baseline short breath or any other symptoms that sometimes it really could be hard to dissect out whether this is something new or whether this is representing blood clot. But we have also seen cancer patients who also a lot of times kind of attribute their symptoms to cancer treatment and doesn't seek medical attention soon enough, which we certainly would like to avoid. So that's why, again, if you have these symptoms, I think it's better safe than sorry. Definitely come in for medical kind of assessment to evaluate whether this is a blood clot or this is something else that we should worry about. So then what are the risk factors for blood clot? So these are a short, concise list. There are certainly more risk factors, but these are the main risk factors that when we talk about blood clot, when we think about. Again, hospitalization, as we discussed before, is about 60% of patients when they have blood clots within the hospitalization or within the 90 days after discharge. Surgery, especially big surgery that people are put under anesthesia and people are not moving around, is definitely a main risk factor. And again, for our purposes, cancer is a main risk factor. Definitely, and we'll talk a little bit about that in a little bit. Immobility, and we're talking about not just sitting in front of during the COVID pandemic, and people are really not as active sitting from a computer. We're more talking about people are really bedbound for at least 3 days, or mainly in the ICU patient where they are acutely ill in the hospital. That's why hospitalization is a risk factor. Again, when you get older, it is a risk factor. If people have a personal or family history of a blood clot or known what we call thrombophilia, so some genetic condition for blood clotting disorder that could have a risk factor. And then people who are using estrogen-based medicine or pregnancy, those are estrogen is known to increase risk of blood clot by at least 5-fold. So we'll spend a few minutes talk about cancer-associated thrombosis. So cancer-associated thrombosis is really nothing fancy other than if the blood clot happens in a cancer patient or blood clot happens in the setting of cancer. So then we call it cancer-associated thrombosis, or in short by CAT. So these slides actually, there are actually more updated data now, but historically we know that from large study, epidemiologic studies show that cancer patients have 4 to 7-fold increased risk of blood clot. There's a recent update from Netherlands database actually show even higher, about 12-fold increased risk of having blood clot in cancer patient compared to a otherwise non-cancer population. And the treatment of cancer also further increased the risk of blood clot actually by about 23-fold. So again, cancer and cancer treatment definitely is a major risk factor of having blood clot. So why is cancer, have such an increased risk of having blood clot? So what factors contribute to this cancer-associated thrombosis? So there are a few different factors we usually think about, and we'll go over that in the next few slides. It could be patient factor related, could be cancer itself related, and also could be cancer treatment related. As we talked about, cancer treatment can increase risk of having blood clot. So first of all is the patient factor related. So such as the patient factor includes such as older age, immobility, again, a lot of these we talked about, obese patients, so increasing body mass index and weight can certainly increase risk of having blood clot. If they have any existing medical conditions that can increase risk of the blood clot, again, a personal or family history of blood clot. And what about cancer itself associated with blood clot? So type of cancer turns out is very important. There are cancer that's known to have a significant increase of having blood clot, particularly the pancreas, stomach, lung cancer, and kidney cancer, brain, ovary cancer. Some other cancer like breast and prostate cancer do have a lower risk, but because the total population of breast and cancer, prostate cancer is much larger because it's a much more common cancer. So overall, the population of patient, the number of patients who can have those cancer and have blood clot are still very large. So I definitely don't think that that's something that we should ignore. Stage of the cancer is important. So as the cancer advances, or the more advanced cancer, like stage 4 metastatic cancer, unfortunately, is associated with a higher risk of having blood clot, because we think that it's the tumor cells that release all those procoagulant substances. So the more of it, it unfortunately does put people at a much higher risk. And certainly, again, hospitalization, immobilization are risk factors. Now, how about cancer therapy related risk factor? So really any kind of cancer therapy, especially chemotherapy and surgery, definitely has been shown by studies to be associated with risk of having blood clot. Different cancer therapy is also a little different. And nowadays, there are also what we call targeted cancer therapy. So they are something we call really target the particular protein that the cancer is producing. So those are a little bit different from the traditional chemotherapy, and there are more and more data came out that they could be associated with increased risk of having blood clot as well. And then in addition to that, the IV line, as we talked about, the PICC line or Portacat, that's very important, and to deliver chemotherapy or to deliver antibiotics, blood transfusion for cancer patients. But they are a foreign body, so when they are indwelling in the vein, they are a risk factor of having blood clot. And again, as we discussed before, so those are usually the people, because the line usually goes into the arm, so those are usually the people who start having blood clot in the arm. So here we want to kind of show you a few research study that have actually interviewed patient and summarize what the patient have kind of talked about. These are patients who are diagnosed with cancer associated with blood clot, and we kind of the researchers actually have a qualitative kind of interview with the patient to try to get a sense of their experience during the whole diagnosis. So here you can see, I won't read everything, but I'll read out just a few to kind of let you see that, a lot of times it's for patient is actually kind of a shock. So here say, but they don't tell you that you're going to get clots from chemo. They never said, but we just put it down to is just my breathing, just one of the information that we weren't aware of. But I didn't realize what it was, what causing it like. Obviously, a clot, I don't have any pain or anything. I just thought I'm getting short of breath anyway, from the chemotherapy or everything. So, and it's just like when you start reading about it, and you sort of realize that, oh, it's actually sort of a blood clot. So there are a few articles directly from patient. It really is so unexpected. Getting a clot is actually, some people even say getting a clot is the worst part of their cancer treatment. And some people feel the urgency is very terrifying. And then, if I had known that the pain was so severe, I would have it sooner. So again, another thing is a common theme is I expect the pain and aches was because chemotherapy. So again, let's talk about it. Is VT very serious? It certainly is. The blood clot is a second leading cause of death, actually in patients with cancer, right after cancer itself. And we do have really good treatment for blood clot. So if it's caught early, we can treat it and we can prevent it appropriately. So the important thing really to recognize the symptoms, not to kind of attribute it to must be from cancer therapy, so that we can diagnose and find it and treat it appropriately and early. So we have a few slides about the treatment for blood clots. So I'll just talk about it. We're just missing a few slides of nice pictures there. So the main treatment for blood clot is blood thinner. We have quite a few. Actually, it's a rapid area of kind of progressing in this area. We have quite a few options now, which is good for providers, good for patient. Historically, the most common blood thinner that we use is something called warfarin or Coumadin. So some people say is known as a rat poisoning. So warfarin and Coumadin, many of you probably knew, that is very cheap, is an oral pill. So it's good in that, but it's also very troublesome in a way that it does, we do need to monitor a level called INR, is a blood test that you have to come in the beginning is, as common as once a week or twice a week to get the level stabilized, then can speed things out. But the monitoring is quite intense, especially in the beginning, because this medicine turns out can interact not only with a lot of medicine and also with the food, especially the green leafy vegetables that you're eating or the diet. So the level can change really quickly. The dose is also very different in every single patient, so we titrate based on that level. So for some people, it could be quite cumbersome and intense. So that's really historically that we've used that. We still have, been using that for some cancer patients, but it's been a little bit falling out of favor, especially for cancer patients. As you can imagine, people who have undergoing cancer therapy commonly will have nausea, vomiting, not really have a lot of appetite, and they can certainly store the number quite a lot. And also we have studied to show in a couple of years, about 20 years ago, we have studied to show that the next class of medicine called lombogaheparin or injection is an injectable that people administer underneath their skin every day. That actually in cancer patients particularly is better than warfarin. In preventing blood clot from coming back and in preventing bleeding complication. So really for the past 20 years or so, the injection has been the standard recommendation for people who can tolerate that to use the needle for cancer patients. Now, as you can imagine, the needles obviously have the side effect of you have to inject it every day, sometimes even twice a day. So it can cause a lot of bleeding and bruising concern and can be quite painful for patients. So a lot of times, people are having trouble to stick with it in the long term. So in the past few years, we actually have a new study, and that's why we routinely use now a new class of blood thinner pill. Some of you probably commonly heard about something called rivaroxaban or pixaban. There's two other, something called dabigatran or edoxaban. So these are four different pills that's available on the market now. That's also pill, and it's quite convenient and does not require intense monitoring like warfarin does, and it's quite convenient for people to take them. They do have their own caveat, which we won't go into detail about this. If you have a question, happy to answer later. But again, not every single cancer patient will fit for that. But these are you will see that more commonly to be done now. And then lastly, the newest kid on the block that is still being researched, being the research study, is something we call factor 11 inhibitor. So it's not on our market yet, so you won't really see it. But I just want to mention it because that's we're actively doing research trying to see if that's even more convenient. It's a once a month medicine actually. So these are the main cancer treatment for blood clot. Then what happened to blood clot? What's the side effect for blood thinner? So the majority of side effect really is bleeding or bruising. As you can see the couple of picture here, people can bruise up quite a lot or having bleeding complication. So we definitely ask people to watch out for signs and symptom bleeding, and can be anywhere, as you can see here. Can be in the bowel, can be in the bladder, eye, and both these. So why is increasing awareness is very important. Again, turns out a previous survey showed that about half of Canadians know that moving is a risk factor of blood clot, but in contrast to that, only 13% of people are aware that cancer is. But again, cancer actually is by far a much more risk factor than not moving around. So that's why we believe that it's very important, again, to bring the awareness to patients and to their family. So, and then finally, just some summarizing final thoughts before we go into some education information for you and open up for questions. So again, cancer and cancer treatment definitely increase the risk of having blood clot. And about half of those blood clot will happen actually pretty shortly after cancer diagnosis, within the first 3 months. So I hope that we kind of show you and to help you understand or recognize the signs and symptoms of blood clot, so that blood clot really can happen anytime. Really, kind of keep in the back of your mind of those symptoms, and if those symptoms happen, then act fast, come in to be evaluated. Because if we were to find blood clot early or relatively early, we do have very effective treatment, including a blood thinner. It could be preventable as well with blood thinner in some selected patients. So again, if you have a signs and symptom blood clot, either blood clot in the leg and blood clot in the lung that we have reviewed, please attend to the local emergency room and attend to the kind of local facility. Even if it's after hours or over the weekend, please don't wait. So again, diagnosing and treatment early is crucial. So I think I'll let Dr. Castellucci take over.
Thanks so much, Dr. Wong. This has been a great presentation. And what we really want to highlight for our audience is where you can learn more about blood clots and their treatments. So Supe, if you don't mind advancing the slide, that would be great. Yep. In partnership with the Canadian Cancer Survivor Network and Thrombosis Canada, we do want to make you aware of a number of resources that we have available on the Thrombosis Canada website. We also have apps that are available for mobile devices, so whether it's your phone or other device. And one of the things that we really like to highlight is the clots campaign. So that's a nice little acronym that helps you to remember the signs and symptoms of blood clots. And we have pamphlets that are available that you can print off, and we actually encourage different thrombosis clinics across the country to have these resources available to patients, whether it's like this on electronic media so that you can take a picture if you like, or download it and remind yourself of what these symptoms are. CLOTS is a really nice acronym that you can see here. So chest pain, lightheadedness, out of breath, leg tenderness, or leg swelling. Those can all be symptoms of a blood clot. And it's important that you seek medical attention, as Dr. Wong mentioned, because we don't want to delay the diagnosis of this. It's important that this be recognized early and that treatment be started early to prevent any complications that may come from a thrombosis or blood clot. As Dr. Wong was flipping through some of the slides, we do have more information available both on our apps as well as our website. And Dr. Wong, maybe I'll have you advance the slides. And so Thrombosis Canada, you can find it at thrombosiscanada.ca as our main website. Next slide, please. And this is what it looks like on our mobile devices. So that's what the app looks like, and it's called Thrombosis Canada. So you can search for it in the App Store and download it to your device. Next slide. And this is what the website looks like currently with our patient and family information tab highlighted. And so you can see there that we have a number of resources available, and these are things that you can view online, and a lot of the information can also be downloaded or printed and shared with patients and family members and caregivers. And as I mentioned, this is something that we encourage thrombosis units across the country to have available to patients. And we also try to encourage oncology centers to utilize this information. As Dr. Wong mentioned, awareness and education is really a big part of knowing about blood clots and what the signs and symptoms are and how to recognize those. Next slide, please. And so these are some of the resources that we have available for patients and family members, and we are happy to share that many of our resources, if not all of them, are available in English and French. And you can download that information and share it. And we also have videos available on our YouTube channel that you can access. And so there are many different platforms that we are available on for you to see this information. Next slide, please. Dr. Wong, I'll pass this back to you.
Okay. Thank you, Dr. Castellucci. I do want to bring this up to if anybody is interested. The ISTH, so International Society of Thrombosis and Hemostasis, which is the biggest organization in the world focusing on thrombosis and hemostasis, so that's bleeding and clotting disorder, actually recently had a particularly want to address the concern of awareness for cancer patients and their family and their caretakers. So this is a collaboration of international experts. We kind of made and a patient representative is actually also in the panel to make this survey and I have there's a QR code you can scan if you're interested, or there's a website here as well that we really would highly encourage people to, again, it's geared towards cancer patient or their family or caretaker to go in and fill out just, whatever you feel is about how your care has been for you, particularly related to the cancer-associated thrombosis, the awareness and stuff like that, because we believe that it's very important to really know what the current status is. Then we can help us to guide us to how to improve next. I will say that currently worldwide, this is actually available in 14 different languages. We want it to be as worldwide population as possible. Worldwide, so far, there's about 750 patients filled it out. They did a quick analysis for the World Thrombosis Day event, and we found that really pretty shockingly, and we really need to do a better job. 2/3 of the patient say that they're really not aware of cancer-associated thrombosis. So we definitely are encouraging the Canadian participation so far has not been the most. So we really want to publicize the survey and really would appreciate if anybody is interested to go in and fill it out. The information is it's definitely nobody's private information will be on there. It will not ask you any of those. These information are really to go back to the ISDH and go back to the researchers to again help us to identify the problem and also help us to improve the care in the future.
Great. Thank you, Dr. Wong. And I think that's really important for us to really reflect on and why we did this particular presentation today. And we did this today because it coincides with World Thrombosis Day. So October 13th is World Thrombosis Day. And this is the birthday of the physician that first identified thrombosis. And so it's Virchow, Dr. Virchow, and it's his 201st birthday. And so this is a really important day for us as thrombosis physicians. And we really want to take this opportunity to educate each other and educate our patients and family members about the importance of recognizing symptoms of VTE and when to seek medical attention. And Dr. Wong, throughout the presentation and our brief chat back and forth, you've highlighted that many patients have indicated they're not aware of cancer-associated VTE. And maybe you can describe to us some ways that we can better sort of translate that knowledge down to the patients and their caregivers, and what sort of strategies maybe we could use to try to do that.
Yeah, thank you, Dr. Castellucci. I think there certainly could be a lot of different ways, and we're certainly always open to ideas, especially from the patient and caretaker side. A couple of things I could think of. For example, cancer patients are very, very aware of chemotherapy related low blood count, like neutropenia and fever, because they literally is like they have done such a good. I think the oncologists are so in tune to it, or oncology nurses, supportive staff. They literally, this is the first thing that they educate the patient. So every single cancer patient getting chemotherapy, they always know, if they have certain fever or temperature at a certain point, they got to come in or they got to call. So I think if we can actually reflect on that practice and, really kind of copy that practice to also, as making, discussing signs and symptoms of blood clots a routine when patients starting on chemotherapy, and also in routine checkup in patient when patients coming back to see their oncologist, or routine follow-up to ask about these symptoms. So I think that could help. Not necessarily physicians, also physician extenders or nursing staff, and I think pharmacists. Whenever they have opportunity to have a face-to-face or to have an education opportunity with the patient and their loved ones, I think these are all opportunities for us that to do a better job to again make people aware of these symptoms.
That's great. Thank you. And, you really highlighted an important part there that we really want to hear from patients and their caregivers. And so that opportunity to complete the survey is really a nice way for us to learn from people who are impacted by this. And so I do encourage everybody to please do that. And if Holly's able to, we'll try to include the link in the chat so that people can do it from there as well. And we do have some great questions in the chat that I will start to ask you. And if people continue to have questions that they would like answered, please enter them into the chat, and we will try to answer your questions. And one of the questions that came in early on is how does or what causes a blood clot? So what causes DVT and pulmonary embolism? And if you can maybe share that with us.
Yeah, so that's a very good question. So I think it's a more complex mechanism than we thought, and definitely depending on if you have the risk factor that we discussed. And I think different blood clot also is caused by different things. For example, a blood clot that's caused after surgery is very different from the blood clot caused by cancer. Even in the blood clot, even though we know that cancer-associated blood clot is common, and cancer does increase risk of having blood clot, but what we call the pathophysiology, the mechanism why exactly that happened, is actually still an ongoing research area. I would say that particularly for cancer related blood clot or cancer associated thrombosis, there are multiple mechanisms. So we think it's a multitude of things, not just one thing. One is as we mentioned, the cancer. A lot of cancer will create procoagulant substances, and that's why when cancer are in more advanced stage, they actually have an even higher risk of having blood clot. The other possibility is, again, if you have a venous catheter that will cause some disturbance of the blood flow, or some surgery, some damage of the blood vessel, that in itself also increase risk of having blood clot. If people are really not feeling well, especially cancer patients, not feeling well, not moving around as much, and so what we call stasis. So your blood is not flowing as rapid as it should because you're not moving around. So that's also a risk factor. So in potentially a cause of blood clot. So I think it's a combination of a lot of these different things. Again, cancer therapy and radiation is chemotherapy and radiation is a risk factor. Also, we think it's because it kind of affects creates inflammation and affects the blood vessel integrity. So that in itself is also probably one of the causes for having blood clot.
Oh, that's great. Thank you. A lot of great information that you shared there. And some other questions that came up from your presentation are really related to types of cancer and associated risk based on type of cancer. And so you mentioned that hematologic cancers do also have a risk as well as solid cancers. Mm-hmm. And one of our participants has a question specifically about multiple myeloma, and the risk of thrombosis with multiple myeloma, and if we know information about exact percentages and that sort of thing. And maybe you can talk about the different therapies and how those also impact risk of clots.
Correct. Yeah, thank you. Yeah. So you're definitely right that different cancer have different risk. Multiple myeloma, even within hematological cancer, leukemia versus multiple myeloma versus lymphoma, they also have different sort of risk. Multiple myeloma is considered a higher, on the high end side, a higher risk of having blood clot, especially associated with a common medicine that's used in multiple myeloma, like something called Revlimid or that class of medication. It started on with thalidomide. There's really significantly increased risk of having blood clot. It's a very old drug for multiple myeloma, and then the next generation is the Revlimid or lenalidomide. They have pomalidomide, more newer generation, but again, they are all associated with risk of blood clot. So I think the percentage, how many percentage of multiple myeloma patient will have blood clot is a little bit variable depending on what study you look at. We do know that it's probably about at least 9-fold increased risk of having blood clot compared to those people who don't have multiple myeloma. So, again, we're looking at maybe 20% in average for all comers. So it's a very rough guesstimate, but yes, you're right that multiple myeloma, especially in those people who are getting the lenalidomide or or that line of therapy is certainly a high risk. And I think this is actually such a high risk that the oncologist is actually very aware of this. And this is one of the things that, in particular for multiple myeloma, for on this drug, they will talk about risk of blood clot. And a lot of times they will actually put some people on something like aspirin or something like a blood thinner even to prevent a blood clot.
Yeah, that's great. And again, really important to know that risks are different based on type of cancer and different treatments associated for those cancers. Some other nice questions that are coming through are related to warfarin, for example, and how it requires INR monitoring. And maybe you can just mention that for our oral anticoagulants, warfarin's really the only one that we use that requires drug level monitoring. And aspirin is not a traditional anticoagulant in the way that we typically think of it. And so we don't monitor levels for aspirin per se, or any of our other anticoagulants really. But just to say that warfarin is a particular class of drug that is not a one dose works for everybody. And so we do need to monitor INR levels and adjust warfarin dosing based on those levels. And there are many things that can impact INR levels, other medications as well as diet and things like that. So one of the other questions that's come in is related to tamoxifen use and what the risk of thrombosis is related to tamoxifen, and does that risk carry forward once tamoxifen is stopped?
Yeah, so that's a very good question. So yes, tamoxifen is also just like lenalidomide for myeloma. Tamoxifen for breast cancer usually is also a known kind of medication cancer therapy that's associated with increased risk of heme blood clot. And on average, it's about 1% of patients overall who are taking tamoxifen at some time will develop blood clot. And so it's about at least 4 to 5-fold increased risk compared to people who are not on it. So I guess the other question, sorry, the other question is how long that the risk carryover. So as you know, the tamoxifen, a lot of times when people are put on it, they are actually on it for quite some time, at least 5 years, my understanding, and could even go up. Some data, even some patients are treated up to 10 years. So this is certainly a long-term kind of treatment. So usually what we do is if a patient got started on tamoxifen and had a blood clot, we will leave them on blood thinner if they have to continue on tamoxifen until they finish tamoxifen. And once they finish it, there's really no evidence to show us how quickly the risk go down, but the usual thought is, once the tamoxifen is out of your system, which in a couple of days is in a general sense, your risk of having blood clot, assuming that cancer is otherwise in remission and not an issue, should be quite low, and you should be able to stop blood thinner. Again, it's one of the areas that we don't really have a great data how long to continue blood thinner after stopping tamoxifen, but that's what we typically do. So we'll continue probably cover for, sometimes we'll even continue for maybe 3 months after they stop to make sure everything's out of the system and stop.
Mm-hmm. And that's great. And that sort of transitions nicely into one of the next questions regarding how long do we treat patients with a blood clot? And, the question here is, do I have to continue it for life, or is there sort of a finite time period? And maybe you can comment on that, in particular related to cancer-associated thrombosis, since that's what we're talking about.
Yeah, so this is actually a very deep question because, believe it or not, it's actually a very common question in our field that has been, a lot of research have been dedicated to it. And whether it's cancer related or non-cancer related is also quite different. So we'll probably, for the purpose of this, we'll more concentrate on cancer. We are certainly happy to talk about non-cancer related. So for cancer related blood clot, once the patient develop a blood clot in the setting of active cancer treatment, the idea is because the risk factors, so we usually continue blood thinner because blood thinner is very effective in preventing blood clot from coming back. So it only makes sense, and also in in data show that we will continue blood thinner until the risk factor is gone. So which means in a cancer patient is the cancer needs to be completely gone, so what we call in remission, and they need to be not on any more therapy. So they are like done with the cancer therapy, then is usually when we start thinking about stopping. I should say though, we treat all the blood clot for at least 3 months anyway. So the assumption is, most people, when they are actively getting therapy, they will get at least 3 months of therapy. And then again, we have to get to the point that cancer is completely gone, no longer needing therapy, is when we start thinking about stopping blood thinner. Now, if a patient is still continues to have active cancer, especially unfortunately the metastatic cancer that we know it will not be cured, or they will continue to be on active therapy. As long as they don't have bleeding complication, the side effect from blood thinner, we will continue the blood thinner as long as the cancer and/or therapy is ongoing. Again, the rationale is because the risk factor has not really been removed. So if we were to stop blood thinner, the chance of blood clot coming back could be high. Some people are starting to do a little bit more easier stuff, thinking there are research ongoing to look at different doses of blood thinner after, say 6 months of initial treatment. Do we really need to continue the same dose? So that's still an active area of research. But right now, I will say that for a patient who have active cancer on active treatment, our standard is to continue blood thinner. Now, with that said, though, I should mention, certainly, as we mentioned, blood thinner can have side effects, including bleeding. So if there were to be, this is something that is not like we put people on blood thinner, we just don't follow them again. So we regularly, routinely follow them. And if there's any bleeding complication, we certainly need to reevaluate to see if it's still making sense to continue. So again, this is an ongoing kind of, and again, cancer treatment and cancer status can change as well. So this is an ongoing thing that we work closely with the patient and their oncologist to continue to evaluate and adjust the plan.
Yeah, that's great. And, sometimes when I'm talking to patients about how long they need to stay on their anticoagulant, I often describe this as part of their cancer therapy. So we talk a lot about how patients are on multiple medications for different aspects of their cancer therapy. And I like to roll the anticoagulant, for example, into part of that therapy. So we know that their blood clot happened either as a result of their cancer itself or the medications and chemotherapy or radiation therapy that they've received. And so I like to describe this as part of their overall cancer treatment because we really want to prevent that blood clot from coming back. And as you said, as long as there is an existing risk factor for a recurrent blood clot, it's important to try to suppress that risk by using anticoagulants if it's safe to do that. So that's great. Thank you. Going back to a bit of the hormonal therapy, there's a question about letrozole and whether it is also associated with blood clots.
Yeah, so that's a good question. It's actually less known. There are certainly a large study that's done in letrozole and tamoxifen. What we know is letrozole or that class of drug we call aromatase inhibitor is definitely not as much as tamoxifen. The risk of blood clot is definitely much lower. But whether it compared to, and there are studies actually show that compared to people who are not taking letrozole or aromatase inhibitor, it really doesn't seem that they have a significantly increased risk of having blood clot. So we commonly got asked this question, say the patient on tamoxifen got a blood clot, the oncologist decided to switch the drug from tamoxifen to, say, letrozole or aromatase inhibitor. Do we need to continue blood thinner? So I think that's actually still an ongoing dilemma, and you can see different people do it differently or recommend different things because we don't really have strong evidence to support one way or the other. But I will say that what we do know is letrozole or aromatase inhibitor has less risk of having blood clot compared to tamoxifen, and overall, at least as far as we know, have not shown to have a significantly increased risk of having blood clot compared to people who are not on it. Now, I'm not saying the risk is zero, so it's again the same idea. Signs and symptom blood clot I still think is very important. to look for it, and especially if people are on letrozole for different reasons, of course, if the cancer is still, underlying cancer is still not completely cured, that still, certainly still will put those people at a higher risk as well.
Yeah, thank you. And a really nice, important question that has come in that I think we can use to, again, sort of reiterate what you chatted about today is, what can we do to prevent thrombosis? So what can our patients do, and what can our caregivers do to help reduce risk of thrombosis?
Yeah, this is a very important and very good question. So I think there are many different things that we can do. For example, not being mobile is one of the risk factors. So those are simple things. Trying to, I know sometimes people are not feeling well, so it's certainly, to do your best in trying to be moving around, not lying in bed all the time, if possible, and certainly having healthy lifestyle, eat healthy, and again, walk or exercise whenever you can. Some of them, the cancer therapy and the IV line, if you need it for your cancer treatment, certainly that's something that we cannot stop. So that's why, recognizing the signs and symptoms are also important. Now, a very important study was done actually in Ottawa by Dr. Kiria and his team, is about using a small dose of blood thinner to prevent blood clot for those patients who are starting chemotherapy. Actually show that a small dose of blood thinner can effectively prevent blood clot and reduce the risk of blood clot by about 40 to 50%. Now, the important thing though is not all patients that we think that would worth the benefit, because again, blood thinner does have risk of bleeding. So as many really in people who fit certain criteria, have certain high risk categories, that a healthcare provider do need to kind of carefully evaluate with their patient to see if they are the best candidate. So again, I'm certainly not advocating for say everybody needs to be on blood thinner just to prevent a blood clot. But since the question is how do we prevent that, blood thinner certainly is one of the best options to do that. And again, I think the important thing is you can certainly bring that up to your oncologist to say, hey, I heard about this, what do you think? Or if your oncologist need help on the local thrombosis expert to refer you to discuss this, that's certainly more than welcome. So that's just one of the options we also use in selected patient population to also prevent blood clot.
Yeah, and I think that's a really important thing, that anticoagulants can be used to treat blood clots, but also to prevent blood clots. And so we use the same anticoagulants for both strategies of treatment and prevention. And so there are several options that are available there. One of the things that we didn't touch on in our presentation that one of our participants has a question about is, how is VTE diagnosed? And, I think I'll just summarize that by saying both in cancer patients and non-cancer patients, we use diagnostic imaging to determine whether or not somebody has a blood clot. And that is based on their symptoms. So for example, if somebody is coming in with leg swelling or leg pain, we will often do an ultrasound to evaluate the veins in the legs to see if there's a blood clot there. And similarly, if somebody has shortness of breath or chest pain, we will often do a CT scan of the chest to look for blood clots. And so those are the most common ways that we will diagnose a blood clot. And as Dr. Wong mentioned, sometimes patients are diagnosed with blood clots sort of incidentally, and they don't really have symptoms, but it's found on their imaging that's being done for other reasons by their oncologist, so staging imaging, for example. And so sometimes we will find blood clots in that way as well. And so again, it's done by imaging. So we need either a CT scan or an ultrasound to help us to make that diagnosis of a blood clot. And so, I would like to just ask everybody, all of our participants today, that please complete the survey. Holly has put the link in the chat, and so it's available there. And Dr. Wong, maybe if you want to go to the QR code on your slide, and people can also use their phone to take a picture of that and access it that way if that's easier. But Dr. Wong, I'd really like to thank you for your presentation today. This has been really great. This is a great partnership between Thrombosis Canada and the Canadian Cancer Survivor Network, and I really look forward to us working together again. And thank you very much for your time today, and I'd like to thank all of our participants today. Your questions have been fantastic. Thank you, everybody. Have a great day, and happy World Thrombosis Day.
Thank you, everybody. Thank you, Dr. Castellucci.